Thank you. Welcome everybody, welcome to this evening's meeting of the Children and Young People Scrutiny Review Board at Derby City Council. I'm Danielle Lind, I'm one of the councillors and I chair the Children and Young People's Overview and Scrutiny Board. I'm going to pass you over to Lindsay Stevens, who's Democratic Services Officer, just to say who's on the call, if that's okay. Thank you, Lindsay.
Yes, Councillor Lind, thanks very much. On the call tonight we have yourself, who's the chair. You're the chair, Danielle Lind. We've got Councillor Testro, Councillor Patterson and Councillor Hazelgrave. We've got two co-opted members with us, or rather one, sorry, Steve Grundy, and officers on the call are David Gardner from the NHS, Helen O'Higgins from the NHS, Joe Ward, Sue Ann Lim and Gamal Nizza. And my colleagues, we've got the Youth Mayor and Deputy with us as well. That's Connie Spencer and Priya Gill. And of course my colleagues Karen Squires and Steve Mason are helping me facilitate the meeting. And that's everybody.
Thank you, Lindsay. Just a couple of housekeeping rules. Please, if you can wait for presentations to be completed before we ask questions. If you do wish to speak or ask a question, please indicate in the chat box provided. Thank you. So moving on now to apologies. Any apologies, Lindsay?
Yes, we have three apologies. Andy Smith, Nikki Fenton and Councillor McChrystal.
Okay, thank you. No late items to be introduced today. Any declarations of interest? No. Okay, right, can we move on to the minutes then? So can we all agree that the minutes are a true, accurate record of the previous meeting? We all happy with that? I'll take silence as confirmation we're all happy, yes?
Yeah.
Councillor Lind, just to confirm, Tracy Churchill, one of the co-opted members, is also on the call. She's just joined, okay?
Okay, thank you.
Thank you.
Welcome, Tracy. Right, okay, so if we can move the minutes then, thank you very much. We'll pass the minutes. Right, so now moving on to the next item on the agenda then. So item 5, so that's Priority Families Programme updates, please.
Thank you, Chair. It's Gamal Nizza. Chair, I'll talk through the headlines of the report if that's okay.
That's fine, thank you, Gamal.
Great, thanks very much, thank you. Just picking up from 4.1 onwards, as members may be aware, the Priority Families Programme encourages a solution-focused, holistic, whole family change work across families rather than kind of single issues for children. 4.2 outlines that in order to be eligible for this programme, there are a number of indicators that MHCLG use and as part of the national programme. These relate to crime and antisocial behaviour, education, life chances, living standards, domestic abuse and mental and physical health. 4.3 for information, Chair, outlines families are referred onto the programme by the weekly vulnerable children's meeting in each locality in the city. And identification then means they can access services they require, along with an identified worker who develops a plan based on meeting the family's outcomes and using the team around the family approach. 4.4 outlines that over the life of the programme, since 2015 to 2020, Derby's target was to work with 2,230 families, and this target is set at a national level. And in Derby, up till March 2020, we had worked with 3,471 families. 4.5 outlines a little bit more data in relation to the programme and the payment by results process, which is also part of this programme. 4.7 outlines the programme is externally quality assured by the National Troubled Families team, and they've recognised Derby's programme as making significant improvements, joining up information in order to have a holistic understanding of family needs. The next steps are outlined in 4.8, that in order to have confirmation of funding all programmes, including Derby's, is continuing to join up data solution so that you actually take a holistic view of the family and intervention support services. 4.9 outlines our commissioned providers deliver additional services to the family which are part of the family's plan, such as mentoring, counselling and therapy service. And of course, in recent times, these services have been adapted in the COVID-19 situation in several ways, including virtual contact, phone or video contact, and providers are also ready to offer additional support if and when required. 4.10 outlines families have been supported throughout the pandemic via the Council's Early Help Service, who have ensured weekly contact with families and with schools, of course supporting the issue of laptops from the Department of Education, and also ensured access to community hubs in the city. And Chair, final point, 7.2 outlines the funding kind of within this programme. So 1.2 million links to a payment by results process, whereby those families, by taking a holistic approach, there has been a change in terms of following the outcomes and support of that process. So that's payment by results and having supported the family in that context. And then 2.2 million is more specific to attachment funding, which is around supporting those families in a broader sense. So the overall programme is around 4.4 million. Sorry, 2.4 million. Sorry, Chair, on that. And then, so very successful. Derby is continuing to meet the national thresholds with intervention and a holistic family approach. And of course, we're waiting for the next spending announcements at a national level as to whether the programme would continue, and hopefully so. So the recommendations, Chair, are to note progress of the priority family programmes to date, and 2.2, note the requirement to deliver sustainable transformation supported by the transformation grant. If I pause there, Chair, happy to take any questions.
Okay, is there any questions? Anybody have any questions? Councillor Hazelgrave?
It's Miles. I was just going to come in with one, if that's okay.
Yeah, okay. Go on then, Miles.
Cheers, thank you. Yeah, just on the part where it said about 2020-2021 working with additional 223 families, I was just wondering whether are we on course to meet that target, and also how does that additional number compare to previous years in terms of the targets that have been set?
Yeah, I think we are on track. I mean, of course, it's trying to balance it with COVID and trying to kind of interact with families. The target has increased slightly as the national numbers increase, but kind of we're in a good position because we were actually supporting 3,400 families. So in summary, yes, we're on track to meet the target, and those additional families will also be supported.
Cool, thank you.
Okay, thank you. Councillor Hazelgrave?
Sorry, I had to unmute. Thanks for the report, Gamal, and Lorraine, who helped write it. And it's nice to see that we are intervening with families as an early stage as we identify them to make sure they get the best in terms of all aspects of their life, and hopefully the children get the best out of their education, or are certainly supported to get the best. The report is really informative, and it's nice to see that we're the service is quality assured from outside by the National Troubled Families team, because that reassures us that things are going well. And the only thing I'd say is that quite often with dealing with families, etc., it would be nice maybe, Gamal, to anonymise some families that you work with and tell their story, because it really brings it to life, and it will put it into a context for everyone on the committee, the kind of things and challenges that families are facing and how they're helped and supported. That's all I'd like to say, but I think it's a great report.
Yeah, thank you, Chair. Just to come back, that's a very good point there, Chair. We will note that to try and include case studies or perhaps some video clips, which tend to kind of bring it to life and appreciate we can anonymise that. So that's a very helpful comment. Thank you, Chair.
Yes, thank you. Thank you, Councillor Hazelgrave. Okay, report is noted. So moving on to the next item, if there's no more questions. No. Okay, so we're moving on to the next item now, which is CAMHS mental health for young people, please. Thank you.
Hello, councillors. I will ask for the presentation to be shared with you, and Helen O'Higgins, our new head of mental health commissioning of all ages, but who particularly focuses on children and young people, will go through the slides which have been put together to give you a summary of some of the information we've sent to you in the reports. As a starting point, I'd just like to mention that back in the early part of this year, they committee had expressed an interest in the work that Safeguarding had undertaken in relation to deaths of young people and the lessons that could be learned. And I wanted really to say, whilst we perhaps moved on in our focus because of COVID and the other requirements that the council have had, that those reports have been received by the Joint Derby Suicide Prevention Partnership, which is a Derbyshire-wide prevention partnership with all sorts of providers there, and Public Health from the city are involved in that, and it's led by Derbyshire Public Health and part of the STP. That's been taken forward there. The actions have been taken forward. Guidance has been issued to our providers, which was the original assurance that had been sought prior to COVID taking over our lives. I'm going to pass over to Helen, who is going to take you through a summary of some of the actions that are taking place for children and young people, and then we'll pick up on some questions. Helen?
Okay, thank you, Dave. So, Lindsay, do you want to move on to the next slide, please? I think Dave's done the introduction on the presentation. So we're just going to summarise the key points from the report that you will all have seen, which has a lot more information in it. So basically, what we're looking at is the number of children and young people across Derby and Derbyshire who could have a diagnosable mental health condition is looking at about 23,000, and we're very aware that the health equity audit identified that a greater level of vulnerability to mental illness than seen nationally, particularly amongst our children and young people in Derby City, and the factors that you'll be very aware of around poverty, obesity and migration that contribute to this. We've outlined in the table the proportion of children who have been accessing mental health services over the last 5 years since this has been a priority and recorded, and you can see that although this has increased since 2016, we did see a drop in 1920, I think, and part of that is due to one of our key providers not being able to upload onto the national data set. So we've been doing a lot of work with our providers regarding that, and in the first quarter of 2021 you'll see that we actually saw a significant increase in the number of children and young people showing on the data set as having had intervention from mental health services, which is very encouraging and leads us to believe that we're on track to meet our target of 35% this year. Next slide, please, Lindsay. So the strategic approach that we have links to the Futures in Mind programme, which I'm sure many of you are aware of, where children and young people are able to achieve positive emotional health by having access to high quality local provision appropriate to their need, as well as a range of support enabling self-help, recovery and well-being. So the key strategy that we've had over the last 5 years has been to really grow the services and the offer at this targeted intervention level before children reach the specialist CAMHS services that traditionally have been available. So there's been substantial investments made in services at this targeted intervention level, and the current focus now is to look at how we triage our children and young people so that they get the right service in a timely way and the right level of support. Next slide, please. So I was asked to just mention what we've been doing in response to COVID specifically. So I know that a number of our providers that had been commissioned for targeted intervention were just coming online sort of from July 2019, and at the beginning of this year the mental health support teams in schools were just starting to deliver. So obviously COVID came at a time when those resources weren't as robust as would have liked. So we commissioned some additional targeted intervention services with voluntary sector providers just for 6 months to support us with the mandate that we had from NHSE to ensure that we were providing mental health offer for children and young people during lockdown and school closures. We also provided an uplift to COOS, the digital online support for children, and we have the online support for carers and parents too. So during those last 6 months, you can see what we have is here, what we're showing is that the purple line is Builds Our Minds, our commissioned service, and you can see that during kind of lockdown the number of referrals dropped significantly, and part of this was their ability to respond because of changes in not being able to go into schools and having to transfer across to a digital offer. And what you can see is that it's a brown line that starts around May time, is this additional capacity that we put in place that's also combined with Builds Our Minds. You can see that by July that was starting to pick up again. What we've done is we've modelled the capacity that we had and looked at the actual commissioned resource that we have is the green line at the top that shows from sort of November onwards. So we're quite confident that we have enough commissioned capacity in the system at that level of targeted interventions to be able to cope, but we are obviously looking at that very closely as we go into this second wave, and as a lot of children and young people obviously are back at school and are starting to present and needing support. We will monitor if we have the right capacity there or not. Next slide, please. So complementing the targeted intervention support at that kind of low to moderate level of need, we obviously have the specialist CAMHS services, which you perhaps traditionally be more familiar with, and we can see that similarly during that lockdown period there was a reduction in the number of referrals that were coming through, and this was seen as being in a large part that professionals just didn't have line of sight of a lot of our children because they weren't attending school. What we are seeing though is those referrals are starting to go back up again, and you can see comparing September 20 with September 19 that they're pretty similar level of referrals coming back through. If you look at the table that we've included, that shows across the main services of CAMHS, across urgent care routine, eating disorders, and the supported care of the caseload. You can see the number of actual activities that have been happening in September 2020 significantly higher than the activity and the contacts that they were doing a year ago, and a lot of that has been down to keeping telephone contact and starting to use virtual means to keep in contact with those children. Next slide. So during COVID and the changes that we've seen over the last year, CAMHS services have maintained their essential services with the minimum number of staff being redeployed into other areas, which because they were seen as a priority area, and they've been able to maintain the urgent care response and the enhanced home treatment teams and the specialist eating disorder teams, which are obviously those key priorities. They developed their model to have a hub working closely with children's emergency department, so that any children that are presenting with self-harm particularly, or any risk behaviours, could be followed up. They set up like an iPad system in ED, so that the teams could assess the child whilst they were in D remotely, and then organise assessment appointments either the same day or the following day for them. So what we have seen is a reduction in routine referrals has therefore resulted in a reduction in the number of young people that are waiting to be seen for CAMHS, but they are starting to see an increase in those referrals going forward now. We have also, over the last 12 months, we've invested in 6 additional CAMHS staff. This is specifically for Derby City and for the South Derbyshire Healthcare Service. And they across CAMHS, specifically targeting the waiting list and those routine appointments to free up capacity, so that the more specialist staff can deal with more complex cases. And we've also put additional resource into the eating disorder services, with an additional psychologist due to start, and 2 additional nurses. And there's more investment planned in 2021 specifically for eating disorders. Next slide. So I won't go through all of this. This is detailed in the report. You can see the services that we do. We have restored following the disruption of COVID and lockdown. That the Changing Lives mental health support teams in schools have adapted their ways of working to be offering an online service, and we have the original Wave 2 teams are now establishing themselves back in those school networks. And you may be aware that we also have been successful in a bid for another 2 teams for Wave 4, which will start next year, and those teams will specifically be in Derby City schools. So we've got one at Noel Baker and another one that will be developed at Bemrose. Also, Minds we've talked about. We also have the user vending team, NDT, that's been that is psychology led, looking at a trauma informed model of care, working with the local authority team very closely to support children to prevent them going into to prevent criminalisation of offences, and to make sure that they get the appropriate support with their mental health and positive coping strategies going forward. We also have again the jointly commissioned trauma informed service with Action for Children that started in September, and those services, as I say, have been restored. And we also have then, as part of our Futures in Mind transformation programme, working towards a community triage. So now we have the building blocks of those targeted intervention services in the community. What we're working with the CAMHS specialist community advisors for them to support a triage to enable children to get the right service at the right time. And the aim as well is that we then prevent those children ending up on a CAMHS waiting list, where they could be receiving an alternative and a more suitable mental health support through another service in the community. Also looking at crisis response going forward, that's the area where we will be having future investments, and we're looking to develop the crisis response 24/7 for children and young people, looking at particularly that initial triage and ensuring that we have robust brief response and intensive home treatment functions there for children to access. Next slide. So this is just covering partly what Dave has mentioned around the CYP Suicide and Self-Harm, the CDOP review that was that took place in 2018. There has been investment through Public Health, have secured funding for post-intervention and for suicide prevention. To move to the next slide, please, and we'll outline what the some of the programmes that relate specifically to children that are supporting the suicide prevention. So there is mental health first aider training that specifically targets 8 to 18-year-olds. We also have Derbyshire Healthcare are leading on suicide prevention training, and that particularly picks up one of the areas from the CDOP report, which highlighted that some of our children with ASD and ADHD are at more risk of self-harm. So that training particularly deals with that issue. We also have, as a result of the CDOP report, Derbyshire Healthcare led on a toolkit that links to local guidance on working with children and young people in Derbyshire and in Derby and Derby City. We also have the 24/7 mental health helpline that is all age. This was starting this year anyway, and because of COVID and the mandate from NHSE, that was brought forward to be all age and to include children. So that now is in place 24/7. There's also the Tomorrow Project, supporting bereaved families and friends. We also have on the Derby and Derbyshire Wellbeing website, there is a suicide prevention specific tile there, and this was promoted widely. All of these different schemes were promoted widely on World Suicide Awareness Day on the 10th of September. Next slide. So last slide here, just thought it was important to cover the work that we've been doing with MH2K, which is through Leaders Unlocked, and they've recruited 27 young people as citizen researchers last year, and they presented their findings last week, in fact. And these people were recruited from diverse localities across Derby and Derbyshire, and they delivered peer-led engagement workshops with, as you can see, 370 young people across the city and the county. Some of the key findings that relevant around needing to really target support at some of our BAME groups. It also identified communication being a key issue about how we get messages across to children and young people and make the messages acceptable to them. We're also working in Derby City with the Emotionally Healthy Schools programme to use these structures to build on the offer for children and young people from BME communities, and the SCARs. We have specific SCARs working in Derby City, and they are expanding their networks and bringing those connections together. We've also, through COOS, they're also looking at targeting their promotion to some of our BAME communities, and as I've mentioned, the Changing Lives Wave 4 networks will be working in those 2 school networks that are at areas of higher deprivation and of a higher BAME population. And this is an area that we've identified for our plan next year for Futures in Mind as we move into 2021, that we need to be giving greater prominence to targeting the areas of health equity. I think that's the last slide. So if anybody has any questions.
Thank you, Helen. Please indicate in the chat box if you wish to speak. I will start us off with a few questions. I'm sure we'll have quite a few. In the report, you referred to long waiting lists. How many children are currently on the waiting list? What is the average waiting time? And how long currently is the longest waiting time on the list? Thank you.
So September 2020, so the waiting times for a routine appointment standing at 21 weeks. For an urgent appointment, as I say, they are the same day, or in the community it's standing at 0.5 of a day. There are the average weights. The numbers waiting we've got here in September 2020 showing us 11 waiting for an urgent appointment and routine 342. So just to give you some comparison there, for the average waiting time a year ago, September 2019, it was 14.82 weeks for routine, and in September 2020 it's 21.72. And you know, this is a reflection of obviously resources have been prioritising the urgent care responses and the priority responses. The numbers waiting has actually gone down during that time. So in September 2019 it was 432, and in September 2020 it was 342.
I think it's quite important to feed back to councillors that we've invested some additional resources into the CAMHS teams, but those resources are reliant on the staff actually coming forward. So there's been a recruitment drive during the time of COVID, and we haven't yet seen the full impact of those staff coming in on those waiting times. We expect fully that once those staff are in place, the plan is that those waiting lists will go back down and the wait times will go down because we put the additional resource in. And critically, we're not trying to funnel everybody into CAMHS services, and historically that's been the only place you can be referred to. And as we now start sending people through to Action for Children, which have got a waiting list of 7 weeks, where you can see a psychologist, you can see a counsellor and so on, that makes a really big difference. So for the vast majority of people going forward, we're trying to move away from the more complex end of provision, and we see over a period of time, and it's no doubt COVID has interfered with this completely, but the intention is that we'll then be able to release staff to be able to doing a great deal more of the casework for those people with complex needs. The other missing bit of the jigsaw is crisis care. We're expecting £1.2 million worth of investment next year in crisis improvements for young people in the community. So we're working on a plan at the moment. Now, if we have more children being seen by CAMHS in urgent care, we increase the staffing there and we increase the support that's available. That will release staff from dealing with urgent things and being able to see people that they need to follow up and follow through. So it's a two-pronged approach. One, increase our targeted intervention, and two, actually provide better crisis response so that we're then able to provide a better pattern of care. So that's a strategic approach, and we gave the safeguarding board full details on this, and we're going back to them later in the year.
Okay, thank you, David. Do we know then how long is the longest wait on the waiting list?
We do. We can ask for that. Some routine reporting stopped during COVID, but we do have some. They do tell us their longest wait. I don't know whether you have it to hand.
I can try and find it. Do you want to take any other questions while I see if I can find that?
Okay. I do have some other questions, but I see Paul has one. Sorry, Councillor Hazelgrave, would you like to ask a question?
Yes, thank you, David and Helen, for your presentation, and thank you also to you and all your team for the work you're doing day in, day out behind the scenes, helping people who desperately need it, I'm sure, in many cases. I'm just wondering about the COVID response and how you may have nuanced that. I mean, I'm making an assumption, and I hope it's a reasonable one, that you originally were very risk averse in terms of how you approached meetings face-to-faces with people who you felt might need them, but that hopefully, you know, the use of PPE and other parts of the service, so I know, have gone to face-to-face and used PPE fully.
Yes.
Have you learned from it that you can be more risk tolerant, obviously within guidelines?
It's a complicated picture. So the CAMHS teams have been seeing people face to face. We've had a number of clinics that have opened up to see people, you're quite right, using PPE and so forth. And the number of staff that have been shielded themselves has been reduced, and we have more people, you know, back on the front line, as it were. In common with many areas, we had a lot of staff off in the first instance. But one of the things that we're finding is also about access of where you can see people, because the schools have a limited amount of space. They used to often say, oh, come and see the person in the school. But at the moment, because of their own social distancing measures, they don't have as much space. So we've seen issues about where you can see a child, and those circumstances have been really quite significant in their impact. But we are seeing people. What we asked the trust to do at the very early stage is to RAG rate all the children in their care, red, amber and green, and to make sure that those children that we're most concerned about still got seen. And those children that we had concerns about, or that the social workers had concern about, because we did this as a system, we also were able to get them seen. We won't pretend it's exactly what we would like, as you would have had fed back from your own services. We've not been able to see everybody in their own homes as frequently as we would otherwise have liked. But we have been seeing people. And interestingly, in the first stages of the virus, many people weren't that keen on the idea of having telephone and video consultations. But we found for both children and for adults that's really changed during the course of the pandemic. And now the number of consultations has really shot up, and some people are preferring them. And of course, we're finding that some of our young people with ASD in particular prefer that mode of communication and find it safer. So it's a very mixed response that we're giving here, but yes, we are seeing people face to face, but actually the physical environment is more of an issue, not PPE.
Oh, well, thanks very much, and it's reassuring that you know, you're kind of learning as you go along and responding as best you can, and also that clearly those people who like some kind of remote contact, a bit like this, but you can at least see them and their facial expressions and pick up a lot, I'm sure, as a clinician about with that. So that's great, and I hope the rest of the board are reassured by that as well.
Thank you, Councillor Hazelgrave. It's great to see that you're working really closely with schools. That's really good to see, and there's a really big emphasis on schools being involved here. However, how is the service reaching isolated children and young people missing from education, children and young people who experience school refusal, for instance?
I mean, that's a difficulty that we're all struggling with, as you know, through the SEND agenda generally, not just particularly in mental health. What we're saying is that the targeted intervention offer is open to anybody. You don't need to have a professional referral. Whilst we're finding that Building Sound Minds take most of their referrals from teachers, you can self-refer through to it. There is a mechanism for that. There are ways in which either the social worker or anybody else involved with the child or the parent can make that referral and get that support. But what we found, and this was very interesting feedback from MH2, the citizen advisors the other day, that you know, we've got this well advertised on a STP-wide website. We have a specifically designed health and wellbeing website with lots of information on it, where you can get help, and all the contact points on it. You know, we've been pushing that through the kind of traditional ways you would expect. But actually, the children are telling us, well, we really need it on a whole range of other kind of apps. That's where it's likely to reach them, rather than through the methods that reach professionals. So whilst I feel happier that schools are more aware, and as the schools are going back, we can push that programme out, it was interesting that those citizen researchers didn't know about a lot of the services we had out there and were available. And in fact, we put in place partly as a result of some of their feedback. So I think there is a message for us all, the whole system, about how we try and communicate differently and get the message out there, because clearly websites and that kind of thing and putting it through practices doesn't reach some of the groups that we need to. So we think that's an issue. We're hoping that with the work that we can do with Bemrose and with Noel Baker, we think we'll learn a lot about how we can work more closely with a whole range of children that we might not be meeting at the moment. And we think that's going to influence the whole programme. That's our intention, and we think that will be helpful not only for SEND but for our wider mental health services. We think that's where we'll get some traction.
I think it's really important that we're reaching the home educated, those children that are not in school, as well as.
Yeah.
So I think that really needs looking at. Can I ask Sue-Ann Lim, what impact have you seen on safeguarding, if you don't mind me asking?
Yes, thank you, Chair. Well, I think in terms of the impact that I've seen, I mean, firstly, we have good relationships with health colleagues, and that's strengthened over COVID. I suppose I'm concerned around the lengthy times for waiting, particularly for those routine visits. With a safeguarding hat on, I know that those will potentially manifest or escalate over those weeks. But I suppose in particularly for a direct impact that we're seeing now, I think in terms of the referrals that I'm seeing at our front door, which is our multi-agency safeguarding hub into reception services, we've seen quite a reduction since pre-COVID. So we were probably getting around 80 or 90 contacts or alerts for safeguarding issues, and this is radically reduced to around 50. So I suppose my concern is around where those risks are being managed now, or are they being seen? And I think there's been some discussion around, you know, how do services reach those hard to reach or hidden children. But my concern is probably around the reduction of those children identified at this present time, and I suppose my concern would be about where they manifest themselves in the future, because we know that potentially the rise in demand is happening. It's not particularly happening from health referrals coming in, so that will be seen in due course. So I suppose that would be the key impact that I'm seeing at the moment, Chair.
Okay, thank you, Sue-Ann. I think in the interest of our communities and these children and young people, it'd be really beneficial if we could have regular updates to the board on this matter. So I'd like to request reports to the board, the next meeting being the 14th of December. Are we all in agreement with that?
Yep. Yes, Chair.
Yeah, that's fine.
Okay, so we have agreement on that. Okay. Thank you very much. Thank you. So is there any more questions before we move on?
Just to note in the chat box, Councillor Lind, we have responded to the question about longest waits. But bear in mind, those longest waits will be for all sorts of individual reasons, because you can have an outlier, and that will include those people that have moved away or can't be seen. We've had people that have been referred and are then unwell for other reasons and can't be seen. So you get those kind of factors. But those are our longest waits.
So your average on your general waiting list then would be the core CAMHS longest wait at 57.43 weeks. Is that correct?
Yeah.
Yes.
Yeah, 57 weeks is our longest, and that's clearly an outlier. The average is 24. And of course, if you turned up in casualty and were being seen, the longest you'd have to wait is 9 weeks. But most people are seen same or next day at the moment.
Right. Okay. Thank you. Right. Moving on then, if we may. So item 7, education and inclusion reports. Pauline Anderson? Is that correct? So item 7, the education inclusion report. Hello?
I believe I'm presenting it rather than Pauline.
Right. Okay, my apologies. Hello, Joe.
Hello. Hello.
I'll leave that with you. Thank you, Joe.
I'll just bring up I've done a brief slideshow presentation just to summarise rather than reading the report aloud. I'm not managing to share my screen. Has somebody else got control?
I don't know. Karen, are you there? Has Joe Ward? Has Joe Ward one of the presenters? Should we?
That'll.
Yeah.
Okay, try now.
That's better.
Great, thank you.
Right.
Thanks, Karen.
So, I'm hoping you can see the
I can.
slide. Excellent. So just a sort of little bit of background. This is the first time that our team have produced an education inclusion report. And the reason it says SEND in brackets is because ultimately we'd like to be able to develop this so that it goes beyond SEN and it looks at other vulnerable groups, other groups maybe that aren't getting the same outcomes consistently across the city, so that we can actually shift our focus very much towards the vulnerable. So this particular one is very much focused on children who've got special educational needs. We're going to sort of be doing some sharing of the outcomes, and it will be the 2019 outcomes, because of course in the summer the GCSEs were cancelled, no tests were carried out, so this is very much based on 2019, and we're going to sort of have a little look and see where we were then. So in terms of how this particular report has evolved, in terms of the team that I head, which is Education and Skills, and that is within Pauline's overarching team of Education, Inclusion and Skills. So within Education and Skills, we've got statutory work, like for example, the assessment work, overseeing exclusions and so on. We also have sold services. We work with academies and local authority schools, and that's one of the sort of great things about it, is that quite a number of academies actually do commission our sold services. And then there are other elements of work such as risk assessment of outcomes and other inclusion indicators that we will carry out for all schools. In terms of Derby City, over the last few years, the focus of our work has become more and more to do with inclusion and more to do with getting the best outcomes for the most vulnerable children in the city. Obviously that was accentuated when we had the SEND area inspection, which did find that there were improvements to be made in the area of provision for special needs. And then in more recent months, the school's lockdown due to coronavirus has actually affected our ways of working as well. So two key differences are an even greater focus on vulnerable children and their experience, but also very, very effective, strong partnership work with other Derby teams and services, such as social care, such as the teams of people who work with SEN, Education Welfare Service, and so on. So what I'm going to just go through is the attainment of those Derby children and young people who have special educational needs. I'm going to pinpoint where we're actually doing a very good job and where we are weaker. I'm going to speculate some of the causes of underachievement, and I'm also going to try and explain what we're doing at the moment to try and provide the challenge and support needed to effect improvement. And I think one of the things that it's important to note before we get into this is that for children who are identified as having special educational needs, there are those children who have got the education healthcare plans for whom there is a statutory responsibility in the local authority. But then there are also the children who have special needs but have not been assessed as needing a plan. And those children are not protected in the same way. But I would argue that we have an even greater moral imperative to make certain that those children are equally well supported and challenged. Added to which, if we do a good job with that group, then they won't need to go for assessment, they won't need to have an education healthcare plan, and therefore we can start to bring some of that very expensive provision which is outside of our area, outside of the city, back in to improve provision overall. So where are we? This is 2019, as I said earlier. And I'm very much focusing on the mainstream schools, although there will be a mention of special schools. And the reason for that is because most children and young people with special needs are actually in our mainstream schools. I'm going to start with the youngest. So going back to 2019, we have overall made considerable improvement in Derby, at good level of development at the end of the reception year. No children with an EHCP reached a good level of development. Now, I'm not certain that this is reason to despair, because many of the reasons why children might have been identified and might have been assessed as needing an EHCP at such a young age will be because they were not thriving. So you'll see later that the story picks up for those children as they get older. 35% having a special need but no plan, they reached a good level of development. And if you compare with the same group nationally, what you can actually see is for those very young children at the end of reception, the Derby children actually did relatively well compared to the national picture. So although we're not complacent, and although we know there's an enormous amount of work still to be done, in particular in the area of speech and language, nevertheless, we know that Derby Sen children do achieve relatively well when they are young. Getting slightly older, we then have the phonics. And again, we've had considerable improvement overall in phonics over the last few years. And in actual fact, overall, we now are stronger than the national average. Here you can see that these children with the EHCPs, 18.9% reached the expected standard, and that is just slightly below the national figure for similar children. But for those children who don't have the plan, 52.3% in Derby, and that's actually 4.3% better than the national figure. We're actually ranked very well in terms of phonics with all of the different authorities across the country. So again, at the end of year one, Derby Send children did relatively well. Getting older again, So here we've now got reading, and we've got the overall figure there, where we're just a bit below national. But then if you see for the EHCP children, we're now beating national, and for SEN support, which is the children without the EHCP, we're close to national, or a bit below national. In writing, got the overall figure. Then you've got the figure for children with an EHCP, which is above the national, and for SEN support below the national, 3% below. And then in maths, again, you've got overall, you've got the EHCP, and you've got SEN support. So in terms of the end of Key Stage 1, we're still okay. Children with special needs in Derby still are relatively achieving in reading, writing and maths. Older again. So now we're in reading, and the reason I've split these is because reading is a test, maths is a test, and writing is teacher assessment. So I've got the tests first. You can see that in reading we are overall a bit below, in maths we're overall a bit below, and in writing we're overall a bit below. However, children with an EHCP, looking at all three subjects, children with an EHCP in Derby do better than their counterparts nationally. Children with SEN support do a little bit worse. You'll notice the rankings have been falling as we've been getting older. So we're still attaining relatively well, but we're not as strong as we were for those much younger children. We now move into Key Stage 4. And so that we can kind of get a theme or a thread running, I've just confined myself to English and maths for the purposes of this report. Obviously, there are other measures at Key Stage 4, Progress 8, Attainment 8, but I'll save those for outcomes reports. So if you have a look, we've got the overall, the strong pass, so that's the equivalent of an old grade C. It's now called a 5. So 38.1 overall, nationally 40. EHCP children, 6.4 compared to 5.5. And SEN support, that fall behind that we started to see at Key Stage 2 has continued and got a little bit worse. So by the end of Year 11, we have students with the EHCP achieve relatively well. Students with special needs but no EHCP have fallen further behind. So the issue for Derby City is more the children with special needs and no plan rather than the children who have the EHCP. I'm now starting to speculate why. Why are we getting this difference in outcomes? And I'm recognising that there is chicken and egg going on here, because the first thing I'm going to talk about is persistent absenteeism. A child is defined as being persistently absent if they miss 10% of the time in the year or more. So that's effectively a day a fortnight. Now, in primary schools, our persistent absence is high anyway. It's high for children with an EHCP, and it's high for children who have special needs and no EHCP. In secondary schools, it's high. It's not high for EHCP, but it is high-ish for SEN support. And if you actually dig in and you find out which SEN children are missing school in the greatest numbers, it's children who've got ASD, it's children who've got social, emotional and mental health, and it's children who are categorised as having moderate learning difficulties, which is quite a big catch-all in Derby. In special schools, we still have that high persistent absence problem, and the special school heads are aware of that and what they need to do. Then we look at exclusions. So this is an indicator of behaviour, and you'll be able to see from those figures that in Derby primary schools, the latest information again is still 2018-19, and permanent exclusion is higher than national. Fixed term exclusion a bit lower than national, but repeat fixed term exclusion higher than national. And the reason that I'm interested in repeat fixed term exclusion is because that's a punishment that a child would get over and over again, and that would suggest perhaps that the school had not addressed the reason for the behaviour and done something to support that child in improving their behaviour. So at primary, exclusions are slightly above national average. But if you are talking about children with special needs, then you see that there is a much higher percentage there of those children who are getting permanently excluded, and also for SEN support. And then moving into secondary schools, again, exclusions are happening a lot in Derby relative to national. So you've got the permanent exclusion, you've got the fixed term exclusion, and you've got the repeat fixed term exclusion compared to national. Much higher than the national average. And again, who is being excluded? Children with EHCPs and children who are categorised as SEN support. The most common reason being persistent disruptive behaviour. So children who are arguing, who aren't settling, and who are causing a difficulty. In Derby special schools, these figures are much lower. Our Derby special schools are responding very, very well to the needs of this group of children and are finding ways to support them so that their behaviour is good. Therefore, it's the mainstream schools where the work is needed. What are we already doing? Quite a lot, actually. So I've just sort of got 6 examples on this slide and the next one. As a local authority, we're working in partnership with the opportunity area. So some examples of that: we are very involved in the SEND peer challenges that have been going on for the last couple of years. I'm on the management group, the management committee that oversees that work. I've also been a lead challenger as well in a number of schools, and there are other members of my team who also are part of that. In terms of the SENCO networks, I again have been working with the university and the opportunity area to influence the agendas for those. I've been attending those, and in some cases I've been making presentations at those. And I also have been providing support for the training that SENCOs get when they first become SENCOs. They have to qualify to a certain level, and I've provided input for that training as well at Derby University. In terms of work with schools and academies, we work through the head teachers strategy group, so the primary strategy group, the secondary strategy group, and some examples of work there. We've managed to persuade heads, particularly primary, who were a little bit more hesitant than secondary, to share their data. And what that has then resulted in is the sharing of an inclusion dashboard, which I've been developing for the last few years, which looks at all of the different indicators of inclusion, such as the ones I've been sharing earlier in this presentation, so that all of the heads can see what the figures look like for everybody else. And that's quite helpful, because you then move into peer challenge, so that they're actually asking each other questions as well. Partnership work with children's social care. This has really come into its own through the lockdown. and as an example of what we've been doing together, troubleshooting on the attendance of vulnerable children. So sometimes that involves a firm conversation with a school leader. Sometimes that involves a firm conversation with the social worker. And what we've managed to do is to develop relationships where we can have those kinds of conversations and work productively together. Over the time of the lockdown, the national guidance said that every child with an EHCP had to have an individual risk assessment which set out where they were best educated, home or school, and looked at the provisions in their plan and made an attempt to reasonably continue those provisions in the plan. I'm proud to say that every single pupil with an EHCP in Derby did have that individual risk assessment, and that is not the case nationally. And not only that, but we were able to get those quality assured by our own educational psychologists and 2 HMIs from Ofsted, because with no inspections going on, we were able to get those to come and add capacity to our team. And every school got a feedback letter about the quality of those EHCP risk assessments. Moving on to the middle line, we now have a temporary member of my team. So if you're not sure, PACE stands for Professional Advocates for Children in Education. And those are the people who used to be called School Improvement Officers in my team. We've got a temporary appointment made, the purpose being to focus on the quality of provision for those pupils who've got special needs in mainstream schools. And one of the things that's happening at the moment is the follow-up of the feedback letters for those schools where maybe they've got more things to think about than strengths. We've also, over the last year, our in-year Fair Access and Exclusions Manager worked in partnership with the principal of Derby Pride Academy, and the purpose of that work was to develop a new secondary behaviour strategy which is aiming at reducing exclusion because the needs of the children are met better. That started in September. Primary schools are still working on their version. So quite a lot going on, but a great deal still to do. So we can't be complacent, but hopefully that gives you a picture of where we are at the moment. I'm going to stop sharing. And if anyone would like to follow up anything there, I'm happy.
Okay, thank you, Jo. Any questions? Any questions? No indication. I think what stood out for me, Jo, was the persistent absence of pupils, because obviously that's going to have an impact, probably a detrimental impact on outcomes, yeah, ultimately, particularly now with COVID as well in the mix. You know, it's of great concern. I mean, I would say that it needs to have a bit of a deep dive into the reasons why. Is there a chance that we could, or I could recommend, the board could recommend that we consult with parent carers on to try and get an understanding of why we've got an issue with absence from our schools? I think that would be really good to hear what the parent carers have to say about that and what their thoughts are and how we can learn from that and how we can, you know, evolve that into ensuring that needs are better met in this city and that their children are reaching best possible outcomes. Pauline, do you want to come in there?
Well, just I'm on the edges. I'd like to firstly thank Jo for her work on the report, which I thought was excellent. And it's the first time we've brought a separate SEND inclusion report to Scrutiny. So I'm really pleased to see it, so that can be an annual feature. And it just brings our attention to this, doesn't it? And it fits really with the wider work we're doing in SEND. I'd like to pick up on that, Danielle, and take all that forward really, and we need to present back to, and I work with parents and carers, but also to talk to young people themselves about what is it, why is school not always a place they want to be, because sometimes, you know, the schools are not necessarily making the reasonable adjustments that are required, and, you know, sometimes what we're saying is if we want a win-win, how can we support schools to be more inclusive, and how can we support families to support children? It's got to be both sides. It's not just one or the other. And we'll be picking up all that about attendance, school refusal, mental health connections, as Dave said earlier, for children with SEND. It's you know, we've a lot of work to do, but I do believe we're getting closer to be able to do it now. We've got a proper SEND approach, really. Yeah.
Okay, thank you. I'd just like to echo that. Thank you, Joe. It was a really comprehensive report, and I'm sure that members have found that extremely, really informative. So thank you for your time. I was just looking on the messages there. Is there any further questions?
If I can, Chair. Yeah. Yeah, I think it's a great report, and it has a clear, lovely message in the heavy type at the end when we read it, and it's quite clear that, you know, children who are diagnosed as having special educational needs but don't have a plan are dipping below, and it looks like they're being failed. But I wouldn't like to say that in bold terms, but they're not getting the best deal, shall we say. You've got all those figures, and all those figures are, of course, aggregates from all sorts of different schools, or secondary schools all lumped together, and primaries all lumped together. And, you know, you must know, and Ofsted should be able to identify the schools which aren't. We need to pull their socks up on this, but we'll need support, and it won't be overnight that they improve. But I'm hoping that there's also a consensus among the secondary heads and the primary heads that this is a really important focus, because, you know, it's a win-win situation. If people do perform better at that level, results go up. They go up across the city, and they go up in those schools that are not doing a very good job, even better in particular. And, you know, that'll get recognition, and it needs to be done. And I just hope that the schools that are involved are acknowledging that, and have got a willingness and a tenacity to keep going at it until they've solved the problem in their school. It's always going to be there. And of course, special schools, they do come out really well, but they do have smaller classes. And if you've got really difficult kids, you know, a smaller class is an easier environment to deal with it. At least they have the high expectations. You know, there are going to be high expectations for the class, the generality of pupils in mainstream secondary schools. So, you know, I mean, I'm really, you know what's going on. You've got strategies there, and I just hope, I'm seeking reassurance that the schools that really need to be pulling their socks up on that are actually doing that.
You're absolutely right. And when I mentioned the inclusion dashboard, there's one for secondary, there's one for primary, and what it basically is a big spreadsheet. It's got the names of all of the, let's say the secondary, it's got the names of all the secondary schools, and then it has got the percentage absence, the percentage persistent absence for EHCP, the percentage persistent absence for SEN support, the percentage repeat fixed term exclusion for EHCP. So for each individual school, they all know what the figures are for each other. And the power of that is they then start to ask each other questions about, why is this so high? Why is this not right? There's other work going on as well, you know, analysis of outcomes. And I haven't talked about things like Progress 8 this evening, but I've done some analysis of the open bucket of Progress 8 and how that also does a disservice to our children with special educational needs, in that the schools simply aren't entering them for sufficient qualifications. So that alone would make a difference to the outcomes for Derby City. So yes, they are willing. They are willing. They do want to improve. But as Pauline said, for some of this, they need some support and some help along the way.
Just the other thing, that, if you don't mind, Chair, I just wanted to say that, you know, I think you're definitely moving in the right direction, and it's good to see that the schools are acknowledging it. Because if you can't, you know, it's like schools in the old days that used to say, we don't have any bullying in our school. the head would say that, and that was their stock response, which was, kind of, they must have been totally out of touch with what kids do around school to each other, but yeah, it's good to hear that, and thanks very much for what you've said on everything, really, and that you're getting a grip, in getting the schools to get a grip with it. Yeah. Thank you.
Yeah, thank you.
Thank you, Joe. So just to clarify then, so we're working closely with schools. Is there currently a planned consultation with parents regarding absenteeism, Pauline?
Sorry, just unmuting. No, we haven't got a consultation out at the moment about absenteeism, but I think in terms of SEND, we are about to start to work in the locality hubs, and what we're going to do is bring parents together on different themes. So one theme will be about, I'm just picking the ones we've already discussed. We're going to look at reasonable adjustments and how to request reasonable adjustments from your school. We're going to, but we could take any theme from, SEND and attendance, SEND and, mental health and well-being, SEND and your EHCP, and look at that. And so we thought we'd break it down by locality rather than, the whole city, so we could actually get groups of parents who are interested in that, and advertise it via. We're going to have a new text messaging service for parents with SEND, and we've also got the various networks and websites. So any suggestions, Danielle? And as we just met last week, didn't we, for a chat? I'm more than happy, to take any suggestions for those hubs, because I think this is just what we've got, the way we've got to work now on forever.
Where will these hubs be based? Will they be based across the city, Pauline?
They'll be one in every sort of roughly using the localities that are used for social care. So we're just looking. We do need a bit of a physical base, but actually quite a lot of it will be done virtually, bearing in mind the virtual world and COVID. But we've looked, for example, at Asterdale School as one area. I'm asking about Derwent in the where Ripples is in there, and we're looking at perhaps for some schools to give us a room, or whatever, so that we can actually have a sort of physical presence, because I think some families still need that.
Yeah, absolutely. I just think it's really important that we're gaining the views of citywide, basically across the board. So I really hope that it will be extended to that, and I hope there will be consultation. As a board, we could put that forward as a recommendation. We could recommend that there'll be consultation with parent carers and young people across the city regarding absence. If that's yes, are we all in agreement with that? Everybody else on the board?
Yeah. That would actually help us. Some recommendations help to move things for us.
So we'll recommend to Cabinet then. We'll send that to Cabinet if that's okay, please, Lindsay. So we'll recommend consultations with children and young people, parents and carers across the city in relation to absence and SEND, please. Okay, anybody against?
No, I just wonder if Pauline's got any other things you'd like us to recommend.
Yeah. I mean, aren't I, where it gives me power to my elbow, and it just helps to move things more quickly sometimes. So we need to plan that perhaps for next time. But please
definitely.
It doesn't have to be here, but if you want to email me any thoughts, then I can take them forward as a suggestion, if not a recommendation from the board. Okay. Anything that Joe's mentioned in terms of elective home education, attendance, and aspects that Dave's discussed about mental health and well-being.
Yeah, could we have those included then, please, Lindsay? The recommendation. Thank you.
Yes, sure. Yeah.
Right. Any more questions? Thank you, Joe, and thank you, Pauline. Much appreciated. Thank you for your time. Thank you. Right, so moving on now then to item 8, which is the topic review, early intervention and youth outreach support. I believe Sue-Ann Lim has a presentation. Is going to start us off on this, which is absolutely fantastic. Thank you, Sue-Ann. I think I'll leave it to Suzanne to explain a little bit more. Thank you.
Okay, thank you, Chair. I'm going to share my screen. Karen, have you enabled me to share my screen?
Yes, you should be okay.
Lovely. Okay, can you see the slide that's come up?
Yes, we can see it.
You can see it now. Lovely. Okay. I mean, I'd just like to précis this by saying that we are just one part, early help and children's social care, just one part of the council, and I would suggest that for Scrutiny's benefit, that there are other parts of the council delivering youth support programmes that would help build that holistic picture. But in respect of my service, you'll see that our specific resource for youth engagement and youth specifically is very, very limited. We have 7 full-time youth workers within early help that work across the city, and if people were around before 2011, you would appreciate that we had a whole youth service within the city that is very much depleted. We have one small resource also within our integrated disabled children's service, that consists of 9 part-time youth workers. They do provide that universal offer for 11 to 25-year-olds for those children and young adults who have moderate learning disability. But for the purposes of committee, the early help in general is not a universal service. It is a targeted provision. So we will only work with young people subject to what's called who've been referred in by an early help assessment. So that needs to be completed by another professional with the consent of the family, and those referrals are considered at our weekly vulnerable children's meetings, which are multi-agency. So you can see that actually in terms of the range of young people and the volume of young people, it is very, very limited. So what do we provide? Well, currently we are not providing any face-to-face group work activity in youth clubs due to COVID. Each youth worker does have a caseload, and so there is detached youth work currently happening across the city hotspots. Sorry, I dropped out there. I'm back again. So we are delivering detached youth work in a very targeted way across the city hotspots in Derwent, Chaddeston, Mackworth, Morley, Arboretum, Austin, Sinfin and Alliston, and we are continuing to offer schools support to those most vulnerable young people. So if I move to the next slide. Okay, so as I've said, it is a very targeted provision of one-to-one support and direct youth work, and it's only on those cases that are open within early help. We have developed some small group work sessions with schools where it's been requested, and those have been 4-week programs with schools. We have continued our support for our young carers in locality 2, and if people aren't aware what locality 2 is, that's the Allerton, Alveston, Bolton and Chellaston area of the city. but they provide, they are based there, but they provide services across the city. But there's no group work activities during half term, but we've maintained our individual visits with those young carers. We do have a good knowledge base across early help of providers that do provide support during the half term for activities, and we do a lot of signposting for those most vulnerable to ensure that they are accessing services. But in essence, that is the only offer that we provide for that youth. And as I said, because we're not a universal service, it's very targeted. Our youth workers probably have a caseload of around 20 families, but you can do the maths in terms of what that actually means in terms of individual young people then that those youth workers are working with. So it is a very small amount, and I think the topic review is absolutely right to look at that citywide response in terms of the city's holistic offer to our young people, because by no means do we meet the needs of all young people in the city. And to be fair, our service is not designed to actually be that universal approach. But happy to take questions, and I can imagine that committee members would probably be quite surprised at the small level of support that we do actually have within early help. But yes, thank you.
Thank you, Sue-Ann. Is there any questions?
Chair?
Yeah.
Sue-Ann, I mean, I'm kind of surprised that it's so low, so small, lower level, and it's quite clear it can't be universal because the numbers are so thinly spread, and they must be working really hard, and obviously really hampered by the whole COVID thing, because you can't get groups together. It'd be 1-to-1 at the most, won't it? And it's a pity really for all those kids who are just above that level of need. They're not quite as needy, they've not got quite as many problems, but they could really benefit, and it'd really make them progress in all sorts of aspects of their lives if they got some support from, because they might not have any stability at home. There might not be any stability or figures that they can kind of emulate or role model themselves on. And it's really, really depressing, and I'm sure that it's not the story just of Derby. It must be up and down the country in urban areas. But it would be interesting, Sue-Ann, to know what the offer is in other cities or comparable cities in the East Midlands. I think that might be helpful for us and give us some bolstering, maybe in some arguments if we ever wanted to make recommendations to Cabinet. Yeah,
I mean, thank you, Councillor Grave. I would agree in terms of the resource being small, and I think the picture regionally and nationally is very mixed. Some areas have completely disbanded their early help offer. At least we haven't done that, so we do have some. We are only one of a range of different organisations that do provide support for young people across the city, and I think through the course of the topic review, you will be hearing from other organisations that are maybe providing filling those particular needs and gaps. But you're right, and I think one of the concerns that I do have, and COVID has exacerbated this, is the fact that we have got a number of emerging needs in a number of different wards in Derby, that actually the resource or the offer that was previously there that might have met that need is not sufficient anymore. There are, I suppose, in my capacity, this is being recognised, and we have got as part of the COVID recovery element of the community angle, this has been absolutely recognised, and whilst early help and children's social care can't provide that level, we are definitely going to be investing in some of the voluntary sector services to provide some of that much needed provision. So that is something that I'm taking forward, to work with the voluntary sector to invest some small amounts of money to enable that reach to be greater and to be more targeted. And I'm also aware that colleagues in the Community Safety Partnership have also invested monies within the voluntary sector as well, because I think this is something around our communities becoming more resilient and becoming more able to support their own children of Derby. I know we do place a lot of pressure on our voluntary services, but actually in terms of COVID and the response to COVID, they have been absolutely phenomenal in what they have done to support vulnerable families on all sorts of different levels. And I think the will is there from our voluntary sectors to step up around safeguarding unmet needs and everything else, and to look at how do communities become more resilient in the future. And I think that is not just necessarily a council funded or delivered service, because that is potentially an unsustainable model. I think this is much more of that sort of societal approach, which we're certainly having those discussions, and I would like to come back in the future to bring back some of the work that we've done with our voluntary sector to actually increase that reach in the future. And I think that will be evident over the next few months around what we've been able to be able to work, how we would work with our voluntary sector community. But yes, a very small contribution, unfortunately. Having said that, in terms of our statutory work, that is, the demand is increasing, and I think, you know, for me, the same comment really that I said in relation to the mental health. You know, if we get it right at the early level, it will stop cases escalating to the point where they do require that statutory service. So all of that rich tapestry of work or services that we've got within Derby City, and what this committee can potentially develop as that universal offer, or that universal picture, and draw partners together, or draw agencies that are not currently involved into that work to work with our young people, would be
Sorry,
I've dropped out again. Yes, we'll be very much welcomed by myself. Thank you.
Okay, thank you. Is there any more questions? No. Okay, well, what I'd suggest on that then is to agree a framework about how we're going to move forward with this topic review. And what we'd like to do is to invite in different providers. So I think for us, we've got to be conscious of how many meetings we've got. I think it's really important that we invite people to address the board, and it would be good for us as a board as a whole to go away as a working group and discuss the findings and what we've heard, and what possible recommendations we could perhaps work up as ourselves with the board, and then bring it back to the board. So in the meantime, for the next 2 meetings, I would like to bring people to the board, and I'm thinking community action, unless anybody else has any thoughts, because I think they're an overarching body that can give us a lot of information and probably help us with that mapping of services across the area with the expertise that they have in that area. The Youth Alliance and Safety Partnership. Now, we've got 2 meetings, so at one meeting we could perhaps have the 2 of the smaller presentations. So does anybody else have any thoughts on any other that they'd
Chair,
like
I don't know if it's still going, but I know the Derbyshire Constabulary used to run kind of boxing clubs or help with boxing, and I think, you know, that was really good to project them but also there's some expertise there, and they also might be able to tell us some useful information about what impact that had on young people's lives in terms of being involved in that. And I think it might be that the funding disappeared. I don't remember all the ins and outs of it, but I think it was really well valued while it was there, and it might still be there. Yeah,
I think that'd be a really good question to ask of the Community Safety Partnership, and I think they'd be able to expand more on about what the police have been doing locally, what they're going to be doing locally, etc. Because I know there's a lot of good work there as well. I think the fire service also works with youths, so they might be a good one if possible. I know we're time limited, but it's really important that we do hear from these services as part of this review. So are we happy for that then? I think the evidence, I think that we would probably ask for is what the target group is, areas of delivery in the city, accessibility, take-up of service, impact, evidence of partnership working to support effective inclusion of young people. Is everybody happy with that?
Chair.
Yes.
When I've been involved in topic reviews before, we sometimes snowballs, and you find that one thing leads to another, you know, and you start to think how you're going to fit it all in. And what we've done in the past is we've had meetings as well, small subcommittee forms of those who can get along, come to people being asked to come and talk to us, and it's during the day. And that gets people in because, you know, they may have responsibilities on the evening. So we might be flexible in how we gather information. I'm just suggesting that.
Absolutely, Councillor Hazelgrave. As I was saying, it would be really good if we could have a working group that can go off and discuss the findings that we are coming across and what our thoughts are as a board, and try and get everybody's views and input into that would be really beneficial. I want as many people as possible to give their input. Please do. So I think that's the way we're going to be moving forward with that. Then if everybody's happy with that, if anybody's not, please speak now. If you'd like to. We're all happy, yeah? Okay then. Thank you. So apart from that, it's the draft work programme. We're all happy with the current draft work programme. We're all happy with topic review. Yes? Can we move on then? Sure. Yeah. Okay, thank you very much. Thank you everyone for your time today. It's very much appreciated. And thank you for guests that came and gave their presentations as well. That was really appreciated by the board. Thank you. Thank you, councillors.
Cheerio, everyone.
Thank you all. Thank you very much.
Yeah.
Goodbye.
Bye, everybody.
Steve, can you close down the broadcast, please? Thank you.